Now, you've been on many rotations in the last couple of years, right?
Yes, sir.
And you've gotten to see obstetrics and surgery and internal medicine and cardiology, acute care and outpatient care in many different forms. Would you find this information about holonomics and integrative medicine useful in your other rotations?
Absolutely. I think taking more data in from the patient and the patient's presentation of dysfunction or disease is going to allow us to more efficiently treat the patient and provide more sustainable medicine.
So you see this information also as providing a certain economy to it, like it saves you time and trouble because you understand the patient?
We understand the patient's presentation of disease in a more thorough way. So rather than spending a lot of money on imaging or lab tests, we can really narrow in what's needed in the imaging and labs to work up their presentation.
Mm-hmm. Now, one of my students runs the emergency medicine department at a large county hospital in Fort Worth. And I was at a medical meeting and she came running up to me in the lobby of this hotel and she said, "Dr. Holland, you're going to be so proud of me." She's been teaching the family practice residents from Parkland Hospital in Dallas osteopathic concepts around how to diagnose patients. Parkland is where President Kennedy was taken after he was shot. And the family practice residency at Parkland Hospital in Dallas has a rotation in Fort Worth at John Peter Smith where the family practice residents get their primary experiences emergency medicine. And so this woman who's responsible for their program taught the medical residents the Jones points, the tender points along the sternum in order to identify which organs correlate with the autonomics of those segments in order to figure out where chest pain is coming from. So by palpating around the sternum and knowing which segments go to which internal organs, the doctor at the bedside with instant information that's derived simply by palpating the patient can understand the presentation of their chest pain in a different or in a better way because they're using more information. She said that by doing this, they have reduced the cost of diagnosing chest pain in the emergency department by 30% in 1 year. So there are real medical money savings in using these concepts in clinical applications that we're only scratching the surface on, because up to now, these types of physical findings and their importance physiologically have not been taken into account in medicine in general.